Welcome back. We've all been there, standing at the pharmacy counter looking at two little boxes. They're for the exact same thing, but one has a price tag that makes you wince, and the other, well, it doesn't. So today, we're going to solve that mystery. We're diving deep into the world of generic drugs to find out if that cheaper price comes with a hidden cost to your health. So let's start with a scene that plays out millions of times a day in pharmacies all over the world. We'll call it a tale of two pills. You know the moment, right? The pharmacist shows you the brand name drug, then the generic one, and you see that price gap. And you can't help but wonder, what am I actually paying for with that expensive one? And more importantly, what am I giving up if I go with the cheaper option? And look, the difference can be absolutely staggering. A classic example is Lipitor, the cholesterol drug. The brand name might set you back over $400 for a month's supply. The generic version, atorvastatin, has the exact same active ingredient, but can cost as little as $10. That's an 80 to 90% saving. It's just a massive difference. So, of course, a price gap that big makes your brain go, whoa, wait a minute. It's just human nature to think, if it's that much cheaper, there has to be a catch. It's got to be less effective or maybe not as safe. And that right there, that's the central myth we're going to put under the microscope today. To really get to the bottom of this, we first have to understand what that word generic actually means when we're talking about medicine. Because it's not just a label for cheaper. It's a very specific and highly regulated category. The World Health Organization lays it out pretty clearly for us. A generic drug is specifically designed to be interchangeable with the original brand name drug. It's made after the original company's patent runs out, which means other companies can finally start producing it. It's kind of like a famous chef's secret recipe. Once the patent expires, the recipe is out, and anyone with the right kitchen can make the exact same dish. Now, this idea of being interchangeable all comes down to a really important scientific principle called bioequivalence. It's a fancy word, but the idea is simple. For a generic drug to get approved, the manufacturer has to prove that it gets the same amount of the active ingredient into your bloodstream in the same amount of time as the brand name version. If it does that, it is expected to work in the exact same way. Same effect, same safety. Now, you might have heard some chatter about this 80 to 125% range and thought, hold on, that sounds like a really big window. And I get it, it does sound that way. But here's the reality check. A massive FDA review looked at more than 2,000 studies and found that the actual average difference between a generic and its brand name counterpart was a tiny 3.5%. To put that in perspective, that's about the same tiny variation you'd find between two different batches of the brand name drug itself. So, okay, that leads us to the big, obvious question. If they're for all intents and purposes the same medicine, why on earth is the price so incredibly different? Where does that huge discount come from? Well, the answer is all about the journey each drug takes to get to your pharmacy. The original brand name drug has an unbelievably long and expensive road. We're talking 10 to 15 years of research, development, and tons of clinical trials. The cost? Anywhere from $800 million to over $2 billion. Now, the generic manufacturers, they don't have to do any of that. They just have to prove their drug is bioequivalent. They get to skip that billion-dollar development phase entirely, and that incredible saving gets passed right on to you. Okay, so the science lines up and the price difference makes sense. But now for the real billion-dollar question. Does all this theory actually hold up in the real world? Let's look at the evidence. Because, proving bioequivalence in a lab is one thing. But the ultimate test is what happens when millions of real people with real complicated health issues start taking these medicines every single day. Are the results the same? To answer that, we're going to look at a truly groundbreaking study from Austria. And when I say this study was massive, I mean it. Researchers analyzed data from practically the entire population of the country. That's over 9 million people, to compare the health outcomes between folks taking branded drugs and those taking generics. And what they found, well, it was pretty stunning. For the 17 different major drugs they looked at, they discovered that in 10 of those cases, that's a clear majority, taking the generic version was associated with fewer deaths than taking the brand name original. Let me repeat that. Not the same, fewer. Let's just look at the hard numbers. For people on blood pressure medicine, the generic users had a 15% lower risk of death. For cholesterol drugs, a 13% lower risk. For diabetes medications, a 9% lower risk. Across the board, when they adjusted for every other possible factor, the data consistently showed that generics weren't just as good, they were often linked to slightly better outcomes. Okay, so this creates a bit of a puzzle, doesn't it? If the science says they're equivalent, and the huge real-world data sets show generics perform just as well, if not better, then why are so many people, and yeah, even some doctors, still a little bit skeptical?
Well, it turns out it's not just one thing. It's this whole tangled web of different factors. For us as patients, it can come from a lack of information or maybe a weird past experience. For doctors, sometimes older physicians or specialists just have habits that are hard to break. Then you have to factor in the billions of dollars spent on marketing brand name drugs, which definitely influences prescribing. Add to that a dash of confusing insurance policies and a whole lot of misinformation online, and you get what we call a perception gap.
And this isn't just a theory. Check out this quote from a major study published in a top medical journal. It found that over a third of doctors admitted they'd prescribe a brand name drug, even when a perfectly good generic was available, simply because a patient asked for it. That just goes to show you how powerful perception can be, sometimes even more powerful than the evidence itself. All right, let's pull all of this together. It's time to deliver the final verdict on generic drugs, a verdict that matters for both your health and your wallet. First, let's talk about the money, because the financial impact is almost hard to wrap your head around. In just a single year, the use of generic drugs saved the US healthcare system $158 billion. That is not just some random statistic. That's real money that helps keep our insurance premiums from going even higher and keeps healthcare a little more affordable for everyone. So when you look at the strict science, the massive real-world studies, and the staggering economics of it all, the conclusion is just crystal clear. Generic drugs are safe, they are effective, and they are an incredibly powerful tool for managing both your physical health and your financial health. And that brings us right back to you. The next time you're standing at that pharmacy counter, you're not just guessing anymore. You're armed with the facts. You know the science of bioequivalence, and you've seen the real-world evidence. So really, the only question left is, what's stopping you from asking your doctor or pharmacist if a generic is the right choice for you?